Hey guys, welcome to another question of the day. Today's question is, what complications do you discuss when you're talking to a patient about a breast augmentation? This is a great question again. I say that all the time, but they're all really good questions. So there are a lot of things that we discuss at a breast augmentation. We talk about all the potential complications that can come up. Clearly, I can't get to everything that's in the informed consent document that you sign when you actually have surgery. But what I try to touch on are what are some of the main things that I see and that I've seen over the past 10 years that I think are important to discuss. So the first thing we do is we talk about asymmetry, we talk about infection, we talk about bleeding complications post-surgery, I talk about capsular contracture, and I also talk about today for sure about breast implant illness. I'll attack a few of those things and talk about why we discuss them. When you come to me, we're going to talk about whether implants are safe or not. There's a lot of discussion going on today, and we are actively pursuing gaining information about who's probably prone to becoming sick from their implants. We talk about your physical asymmetries. All women that I see have some type of physical asymmetry where the skin on one side is more loose than the other side. The breast sits differently on their chest wall on one side, meaning the fold might be lower on one side, so the breast sits differently. And that's something that I normally can't change about your physique. That's just who you are. We also talk about you not being active for a certain amount of time after surgery because of the bleeding risk of you being too active after surgery. So when you come to see me, I try to hit all of these topics that I think are big things that could come up in your surgery post-operatively and discuss them. But again, I can't possibly hit everything. So if you come to me and you have other questions outside of that, I of course encourage you to ask them. But those are the main things that I discuss when you come to see me. That's a great question. I appreciate you asking it. Again, you guys ask the question and I'll answer it. Have a great day.